joined today for our first broadcast by Kim Brookes, who's a clinical nurse specialist working with head and neck cancer patients. And I'm very, very grateful for Kim to share her time with us today. I know particularly how busy it gets in services, so I really appreciate your time today, Kim. So from here on in, I'll be referring to head and neck cancer patients as H&N patients. So can you tell me a little about yourself, your work, and your role with H&N patients?
So I am a clinical nurse specialist within the head and neck speciality. I work at Russell Sore Hospital, which is in the West Midlands in the UK. I'm a standalone CNS in this hospital, which means that obviously there is just myself within this role. So because of that, I think the role can be quite diverse. There's an awful lot of communication, coordination between me and other services, along with patients and on behalf of patients. There is a lot of hands-on clinical work, plus a lot of, a lot more telephone conversations now than we've ever had. It's quite nice. You get quite a variety of jobs to do, which is quite nice. But ultimately, it's all for the benefit of the service and the benefit of the patient.
And when would you be most involved with patients?
To be fair, really, I mean, from the very beginning, I mean, ideally, I like to be there from the very beginning. So as soon as they're given that diagnosis, I'll try my very best to be present at that point. I think that's the key, if I'm honest with you, because that for them is probably the worst time. And having that one person there that will be that ongoing link throughout the whole of their journey is really important. And then along that journey, I sort of dip in and out of the process. They don't have treatment here at this hospital. They go to another centre. So I sort of back off slightly then, because that hospital also has CNSs that will get involved. But I'm never really that far away. And I always try and keep as informed as I can. So I have very good links with the other hospital, because I think it's important, because me being that first person they meet, I tend to be the one that they will keep coming back to. And it's not because I'm any better than anybody else, it's just that I'm the first person that they met, so you just get that bond, don't you, which you like to keep.
Yeah, I think that's a key thing, that connection with clinicians such as yourself.
Yeah, definitely.
What do you think are the most common questions, Kim, that you get asked by patients, head and neck cancer patients?
I think at the time of diagnosis, it's very much, am I going to live? Am I going to recover? Can you make me better? Am I going to die? We will tell them what we see is quite a positive diagnosis, in the sense that something is very small, it's very amenable to treatment. But to them, the minute they hear that word, the majority of patients just see that, and imagine the worst possible case scenario.
And what do you think are the most difficult challenges that head and neck cancer patients face? What do you think is the most difficult challenges that they enjoy?
I think for them, the nature of where the cancer is very difficult for them. Within this area here, whether they've had surgery, radiotherapy, or a combination of both, ultimately their appearance will have changed in some way, whether that be just from acute burns from radiotherapy covering the head and the neck, or a hole in the neck through which they breathe. These are things that you can't cover up. You can't keep those things private. I think patients who have had breast cancer, albeit as devastating as any other cancer, you can choose to have reconstruction. You can choose to cover that area, and really nobody really needs to know. Head and neck cancer patients are very open to the public, and I think are very vulnerable, because of that reason. It just can't really be covered that well at all.
It's the public nature
It is.
of the
It is.
aftermath of treatment as well,
Very much so.
particularly.
Yeah, very much so.
And in my experience, they're very conscious of those kind of changes, unfortunately.
They are, Jan, and I think the patients you and I saw together, they know that when they speak, they don't sound normal. That they know when they speak, they may drawl. In neck breathers breathe through a hole in their neck, so there is a sound that it makes. And people sitting or close by will very often, curiously, out of ignorance, stare, point. Some even ask. I've noticed some of my patients have said that strangers have just come outright and asked them, like, what's that there in your neck, or why do you talk like that? They don't always want to share that experience. But they don't really have all that control.
There's a quite intrusive. It's a quite intrusive quality, I think, isn't it? That people are inquiring for a range of reasons.
Mm-hmm.
It's not. That's very rarely helpful in people.
I agree. I don't think it's ever very helpful. I think it puts patients on the spot, and I think it makes them feel backed up a corner, really, if I'm honest. And I think some of them feel obliged to give an answer when really they shouldn't have to.
Yeah. I should let people know that you and I, Kim, we worked together in Russell Hall Hospital for quite a while. Yeah.
We did.
So we have prior experience, I think.
Yeah.
So what are your thoughts on the psychological recovery as opposed to physical recovery? And do you see a role for a psychologist involvement in the overall care of a patient?
Absolutely. I think physical recovery generally, if things go to plan, is fairly quick. And even physical recovery that ends in a disfigurement of some sort, with the right information and the right handling of that patient, I think that recovery can be quite good. Psychologically, I think that's more of a challenge. One, because I think some patients struggle to accept the need for psychological support. I think it's something that's not always that well recognised in professionals, and I will be honest and say that I think prior to my working with you and working alongside you, it probably wasn't something that I ultimately would think about getting involved with so soon on. But I wouldn't hesitate about asking my speech and language therapist colleagues to get involved. I wouldn't hesitate to ask my dietitian colleagues to get involved. I now see the psychological role as important as that. But I do think it's more of a challenge for the patients. You tend to find a certain type of patient, a certain generation, don't like to admit that there is a need for psychological support, and I think sometimes that's half the challenge, half a battle, a big battle sometimes.
Yeah, I think people can construe a referral to someone like me as a statement of inability to cope or
I agree.
deficit of some kind, and it's not that.
It's certainly not. No, it's not at all.
It's a galaxy away from that. It's care, essentially.
It is.
What's the best advice perhaps you can offer to patients during treatment and afterwards?
I think they have to be comfortable to be very honest with us, brutally honest. We appreciate that they won't always perhaps tell us what we want to hear, but I think if we're going to work together, and it is a team effort, the patient has a big role to play, as do all the healthcare professionals that are involved. They have to trust us. They have to have faith in what we do and believe in us. If they don't, they need to tell us they don't and the reasons why. But ultimately, I think to get the best outcome, we all have to, believe in what we do and have faith in each other. And that works for me as well with the patient, so it works both ways.
So candor and honesty, really.
Very much
And
so.
you can keep the
Yeah, very much
communication
so.
lines open.
Yeah, I'm sure you know, lots of other health professionals will know that sometimes it's pretty obvious that patients are telling you what they think you want to hear because oh, you've worked so hard for me, you've tried so hard, so I can't tell you that I'm not happy or I feel miserable or I'm in pain. I want to tell you I feel well, I want to tell you I feel fine, but they can say those things, but I think if you're astute enough, you know that they're not being very honest.
Any final thoughts, things that you'd really like to kind of say to patients as we're kind of concluding?
I think with regard to the psychological side of their journey, never be afraid to accept that help. Just take it on and go with it. And be very open to it. As I said previously, that they wouldn't bat an eyelid if it was a dietitian or if it was a physio or if it was a speech and language therapist. And I think for me, having worked with you and having seen the benefits of psychological support, I would certainly encourage all patients that if it's offered or if they feel they need it, to please take it and take it sooner rather than later.
Okay, well, with that very gratifying endorsement at the very end, I think we'll probably conclude there, Kim. Thanks ever so much for your time.
You're very
Really
welcome.
appreciate it. I do. I really appreciate your time and
You're more than
sharing of
welcome.
your advice. Okay, so thanks ever so much, and we'll leave it at that.